Hello everyone, welcome to DocEngage. This is Jayashree. In this video, I'm going to explain you about care plan. Care plan is basically for the clinics or hospital who provide home care services for the patient. For most of the home care clinics or hospital, care plan is one of the most important feature to assign the treatment plan and to track them easily. Basically, care plan is useful for chronic, acute, long-term or short-term care patient like diabetes, injured, COVID care patient or for any therapist. Using this care plan, you can create treatment plans for 1 week, 1 month or for 1 year to provide the home care services for the patient in a long-term duration. So, and now I'm going to show you how to create a care plan. For that we can create some templates and we can use them for creating the care plan for the patient. Let me show you how to create a template first, and then I'll show you how to create a service plan for the particular patient. So to create a template, I'll go into the settings, and in the templates I can see this service plan here. If I click on this, there is one option for service plan template, service plan name and service plan work list as well. So here I need to go to service plan template because I want to create the templates for the care plans, and these are the templates which are available. I have created now, and to create a service plan template, I'll click on this add template. Here I can choose the care centers. For each care center we can create the service plan care plan uh, so differently. So each care center may have different care plans, so we can create them for the each care centers as well. So right now I'll keep all care centers, and here I need to give the care plan name. So for example, nursing care plan for injury, or for a diabetes patient, or for COVID care patient, you can give the service care plan name as per your organization requirements. So here I'll just write right now nursing care plan for fracture patient. This is my service plan name, which is care plan name, and I can add the services which are available in that particular care center. Right now I have given all care center. These are the services which are there in all the care centers, and here medication is there. All the medication which are added in the inventory will show here the medication list, and instruction also. If we have added any instruction templates, that instruction templates will show. We can select that instruction template to this particular care plan, and also we can use the packages, also packages services which we have created. We can use this particular package and we can create the service plan templates also. So for that, now I'll choose some services which are there in the care center, and I'll create a care plan. So for I'll write doctor virtual consultation for fractured patient. This is the service name and the cost of that particular service and plan days. Now I need to enter the number of uh, days planned for this particular care plan. So I'll write 30 days plan, and this is the minutes for that. And also for this particular service, it is 15 minutes. If I want, I can change also. And what is the visit? I'll write 10 visit for the doctor virtual consultation, and repeat 3 days once. I'll write 3 days. So every 3 days a doctor will have a appointment for this particular patient. I can even edit this or delete the service. And next I'll write nursing assistant, and for 30 days I'll write this plan as well, and what that is for 60 minutes. And also I can give the number of visits. I'll write 60 visits, and each 6 hours. I want to repeat this every 6 hours. So save every 6 hours once that particular nurse calendar will be blocked. And next I want nursing supervisor visit. This I'll plan for 30 days, and number of visits will be 15-minute visits, and it will be 2 days. So every 2 days, this particular supervisor will visit the patient, and this is the services which I want in this particular care plan, and I can even add the instruction if I want, and medication also. I'll write some medication if I want to give. I can choose some medication from here and add instruction. I want to add instruction for the patient medication plan, number of days 30 days, and I can write the body also. So instruct how to take medicine. So I can write any instructions for this particular care plan. I can also add the activities for this care plan. I can make call, meeting, or task also. I'll write dressing, activity name, and plan, number of plans, days plans. I can give like third. I'll give 15 days and duration for 15 minutes, or else for 30 minutes. Since it is dressing, I'll make it 30 minutes and save. So this particular care plan has these many services which are there in the this particular care plan. So I can save. The care plan is added successfully. This is how we add the care plan, and that care plan will show here in the list page. So this is the care plan which is created. This was the care plan which I have created initially, and next will be like care plan name. I can create some care plan name also, and this particular care plan will show in the create service plan drop down, where I can choose the service plan name and save. And next, if I want to add any service plan work list, I can add service plan work list also. Just write the work list name and save. I have added few here. So this is how we configure our care plan templates. Now I have showed you how to create the templates. Let me show you how to add the care plan for particular patient. So first let me select the patient called Sanjana. This is the patient registered in my care center. And here I have the create service plan option. If I click on this, I have the select service plan name. Just now I have added few care plan names, and those service plan names are showing here. I can select one name, and just if I scroll, I have tick mark here. To do that, I can even give the custom name also manually. And from if I add from the template, all the care plans which are created will show here, and I can select from this particular templates. So I'll select this template, and I'll give the start date. Start date, let us say November 10th is the start date for this particular care plan, and doctor who is assigned to this particular care plan is will be Dr. Ankit, and done. So now it is the care plan is added and the page sent to Dr. Ankit. It is not saved. I can even do the save. If I want to edit, I can edit also. Before this, we saw one option called force save. If I do the force save, then it will be the status from not saved, it will automatically save. So I'll show you that. I'll write the start date, select the provider, and force save. So these are the plans which I selected before, and this is not saved, and these are the plans which I force saved just now. It is showing from planned and scheduled here. So if I do the force save, then it will be directly saved. So I can edit this if I want, or else this, if I don't save it, if I don't give a force save, then it will not save. I need to edit manually and save each service. So this one I'll edit and save. Now it is saved. I'll edit, and here if I edit, I have for this activity, I have the activity name, date, and also I can select the time, and provider name. If I want to change the provider name, I can change status as well. If I want to notify to the provider and the patient, I can use this notify option. And if I want to send reminders to the patient as well as the provider, I can use this also. If I enable this one, then the notification reminders will be sent to this patient and providers. Now the status changed from not saved to scheduled. Next one, service. If I go to this service, here I have visit type and date time, provider name, stay and the status, and even I have the visits, number of visits which I have added while creating this care plan. It is showing here. I have given 60 number of 60 visits, so it is showing 60 here. If I want to give any discount, I can give the discount in percentage. If I want to give a flat discount, I can use this override OD option here and give the discount also. So I'll give 100 rupees discount, and I can add the tax template here and repeat each. I have given repeat each 6 hours once, so it is showing 6 hours, and the number of appointments based on the visit. It is creating the appointments, and here I have same notify option for the both provider and the patient. If I enable this, then both the provider as well as the patient will get the notification. If I want to add any sold by, for example, there is one provider who has suggested this particular care plan to the patient, so we can use that provider name here in order for the reference, or if you want to appreciate that particular provider for suggesting this care plan for the patient, then you can use the sold by provider name as well. And next, if I go to appointments here, I can see all the 60 appointments which are there for this particular care plan, and everything is in non-scheduled status. We can change this to scheduled. You can edit this and make it scheduled, and done. Okay, so there is another appointment for this time, so it is showing the conflict. Okay, so you can change the timings. Right now it is showing that there is some other appointment, so we can schedule this appointments which are there in non-scheduled and save. If I go into this work list, here I can add the work list for this particular care plan. For example, I want to add dressing. So this is the service plan work list which I have added in the settings. It is showing here. So I can just enter, and next feeding. So if I add uh, just few words, if I start typing, all the work list which I have added in the templates will show here. Next, also I can write any work list. If I want to add, I can add that. And in the outcome, if I go into the outcome here, we can use the preconditions, and also if I want to add any assessment form, I can add assessment form uh, by selecting here only while doing the chatting and marking it as checkout. Only if the provider has filled this particular assessment form, then only he can do the checkout, or else will not have the provision to do the checkout. And then if I want to add any assessment form, you can add the assessment form. This is purely optional. This is based on your organization requirement. You can add the assessment forms here. And we also have the package option here. I can use the package option also, and save. So, okay, the timing is now getting conflict. That's why it is showing like this. So if I say that, then all this will be saved, and this particular care plan is created for the patient called Sanjana, sorry. And then if I want to add a care plan manually without using the template, then I can do that as well. Let me go into this particular bag, and I'll create again service plan. So I have service, medicine, activity, pathology, radiology, instruction. So I can choose from here also. If I click on this, all the services list will show here. I can choose the services and create the care plan as well. Same thing, creating appointment, scheduling the appointments, and writing the work list. Everything will be same. We can choose the services manually here for the care plan for a particular patient. So let me select the doctor virtual consultation. I can select the provider here, and I also same thing, the discount. If you want to add discount tax and the repeat each time, and rest of the thing will be same. We have one more feature here. If I click on this drop down, I have add and save and add one more service. So I can save this particular appointment which I have selected from the list. I can save this service and add one more service for this particular care plan, and also I can add the medicine. So this particular appointment which I have service which I have added and the appointment which I have created will be saved, and I can add one more medicine and activity for the care plan. So same I can use add the instruction radiology or pathology and save. And I can even choose the packages. All the packages which are created in this particular care center will show here. I can use the package on create the care plan as well. So let me show you. For this particular package, these two services are there. I can make it I can give the visits and repeat hours. So I'll give 2 days, and I'll change the provider to Dr. Prakash and save. Oh, sorry, I have not given the service plan name. Let us say this is, I'll say consultation package and save. And now I can save this service. So now care plan is created, and it is planned as well. Same thing I can do for this particular service which is there in the package also. Package service name is already there. I can save this provider. I'll change the provider and save. Okay, same thing. Timing is there. So I'll select for the Dr. Shalini, and I have not given the repeat each, so I'll give 4 days. 4 days and save. So there is appointments which are booked for this particular patient. That's why it is showing. You can configure this timings and hours based on your patient requirement and your requirement. So I'll change the date and say still it is showing that there is one appointment. So let me make it to the next one and save. I'll change the patient and do it again. Uh, Let us say patient Rakshita, and I want to create a service plan. Then I can create the service plan. So right now if we repeat each visits, I'll make it 5 visits. I'll change the package and I edit this. Visit 3 is there, repeat each 2 days and save. Sorry, again I forgot to change service plan. I'll write repeat each 3 weeks and save. So now this is planned. The status has changed from not saved to planned. So this is how we can see the we can create the service plan for a care plan for a particular patient. With the different providers also we can change by changing the provider name in the appointment page. And these are the package service care plans which I have created today. I can use the filters here and see the list as well, and I can create service plan from here also, add service plan. And this is the appointment which I have care plan which I have created now. And also if I click on this actions button, I can view the service plan, create invoice for the care plan which I have created, and I can even mark as complete if the care plan treatment is done. Then we can mark it as complete. If you want, if for some reason if the patient says that he wants to discontinue after taking service for 20 days, we can discontinue the service plan as well, print the service plan and cancel the service plan. We have all these features, so I hope you all understood. Thank you all.